Thank you. So welcome to the Emerging Technology session today. As we are about to begin our series on ChatGPT, starting off from more of a business perspective today on what it is, what it's good for, and what to be wary of. The next month, we'll get into more of a technical focus, more into machine learning technology behind it. And if we have a lot of interest, we'll have a third session. We have lining up a machine learning professor from Carnegie Mellon who's came highly recommended. Typically, we present during the first half hour, then we'll open up for discussion. So please feel free to type in your thoughts or questions in the chat as we're going along. I'll go ahead and read them off as we do our moderated discussion. I'll weave them in as people are going to raise their hands during that moderated discussion. One of the best values of WEDI is learning from each other, so don't be shy. Ask questions, share your experiences, your concerns, your successful practices. It's benefit for everybody. So introducing this month's presenter, Sara has a very impressive bio. I just love to read this one, Sara. Sara Lord is a partner in the Litigation and Healthcare and Life Sciences practice groups at Arnall, if I'm saying that right, Golden Gregory LLP, where she also chairs the government investigations team. Before joining that organization, she spent 27 years as a federal prosecutor, first in the public integrity section of the criminal division in Maine Justice, and then as an assistant U.S. attorney in the Northern District of New York, where she was also healthcare fraud coordinator. So don't mess with Sara, right, Sara?
I hope not.
Right. So this is really interesting. From 2007 to 2009, she was part of a detail from the Justice Department to the U.S. Embassy in the Kiev, Ukraine, where she worked on developing anti-corruption legislation and an ethics code for public officials. A graduate of Yale College. She earned a BA, MA from Oxford University and a JD from Harvard Law School. Sam Holvey discovered Sara after reading her article on the risks and benefits to healthcare providers using ChatGPT to support billing claims. And I'll share that link in our chat. It's been delightful meeting Sara and hope you enjoy her presentation today. So thank you, Sara, and the floor is yours.
Thank you, Ed, and thank you everyone for having me. Before I get into sort of more strict descriptions of risks and benefits of using ChatGPT, I thought it might be helpful to talk a little bit about where we are and how we got here in terms of the technology. And part of the reason for doing that is that while the benefits appear to be great and growing, the risks, especially the speed with how we got here, present factors that we really also need to consider. So I also asked Ed before we started sort of how knowledgeable and how experienced the group is with respect to ChatGPT or GPT. And the answer was that apparently it's a bit of a bell curve. So for those of you who are experts, I hope I get it right. And for the rest of you, I hope this is useful. GPT stands for Generative Pre-trained Transformer, and is sometimes referred to as a large language model or LLM. For me, the best way to understand it is that it works predictively. It predicts the text in response to a question or a query that is presented. The predicted text is based on the content that has already been created and published online up until that point. Where ChatGPT, or I'm sorry, GPT differs from, say, Google is that it's capable of responding to questions. With Google, Google searches out the words and the terms, but the GPT is actually capable of predicting the response to the prompts that the user puts in. And it can then be And this is the key factor that has brought us to where we are today. It can be fine-tuned for a range of natural language processing tasks. We all found out about this on November 30th, 2022, when OpenAI released ChatGPT. And ChatGPT uses the large language model that is 3.5. 1.0 was first came out in 2018. So ChatGPT, it's fair to say, immediately set off a firestorm. It was advertised as being capable of answering follow-up questions, of admitting mistakes, challenging incorrect premises. So for example, what kinds of tanks did they have during the War of 1812? ChatGPT, unlike Google, which would produce articles that contained those terms, was capable of saying that there were tanks during the War of 1812. It immediately became the fastest growing app of all time. There were over 1 million users within 5 days. And by January of 2023, there were over 100 million users. It also became the most quickly adopted and adapted software that has ever been made. Within days of ChatGPT having been released, a TikTok video showed how it could be used to write an insurance appeal letter. And that video had more than 143,000 views by early January. Then on February 10th, 2023, Doximity released a beta version called DocsGPT. DocsGPT was made available to Doximity members. It includes a library of medical prompts, all of which are designed to enable the user to generate different types of administrative and even medical record documents that relate to patient care and other administrative tasks. From my perspective, the most critical one of these tasks would be billing. But as you can see, the list of options is extensive. This is just a partial list, but it includes insurance appeals, prior authorizations, progress notes, post-operative instructions, procedure notes, referrals, certificates of medical necessity, and so on. And although it's not listed on this slide, it also includes notes excusing people from jury service because of various health reasons. As you can also see, there's sort of a mixture of what might be called administrative and what might also be called clinical tasks, but all of which are generated in response to these prompts. It was released, as I said, in a beta version and designed to encourage feedback from the users, and using feedback designed to improve, fine-tune the responses and the products. And this is itself something to consider because the feedback obviously helps to improve the product, but it also allows for the possibility of sort of much information being poured in that may not be sufficiently sifted to produce what are exactly the right answers or the right language for the right situations. Sorry. I mentioned that the risks include the speed with which these technological developments have been happening. ChatGPT came out on November 30th, 2022. By March 13th, 2023, AI announced the release of GPT-4, another sort of large language model that, despite the fact that it seems to represent only a 0.5 increase, may in fact represent a pretty massive increase in the capability of the technology. GPT-4 is more advanced in three specific areas. It's creativity, it's visual input, and a longer context. As a result, it's much better at collaborating with the users. A couple weeks later, on March 30th, 2023, AutoGPT was released. And AutoGPT, which uses GPT-4 for the language model, is artificial intelligence that actually interacts with humans. It allows the GPT to self-prompt and act autonomously. So while the ChatGPT 3 allows for a response to a question, GPT-4 actually sets a goal, and the app will take a step-by-step approach without having to have new prompts in order to produce the result or to answer the question. And the example, this was released on GitHub, but the example that was released or accompanied the program was actually a task. And the app was asked to create a recipe for an Easter dish. And it did it. So it literally sets out its reasoning and explains how it accomplishes the task. AutoGPT is not the only example of an app that has the capacity to self-prompt and to act autonomously. There's Microsoft Jarvis and Baby AGI, which also allow the GP to do these two functions. And as you can see, the slide sort of then went on to predict some events in the fall. But before we get to that, I have to talk about another development that literally occurred on Monday, April 17th. Microsoft and Epic announced that they were going to be bringing GPT-4 into use for drafting messages, responses from healthcare workers to patients, communication between healthcare workers and their patients using this app. The other part of this announcement was that they would be using GPT-4 to analyze medical records and look for trends. Those trends could be both sort of medical advances and diagnoses, but they also include trends in financing, claims, and costs. As a result, this information is going to be used for natural language queries, and it will allow searches across large numbers of patients to identify trends. And of course, anytime we hear something like that, we think HIPAA, but I'll get to that a little bit later. So just the fact that within days we have more and more announcements about new uses of this technology in the healthcare space is an indicator of how rapidly the world is changing right in front of our eyes. I mentioned these were predictive, but GPT 4.5 is expected to be released sometime between September and October of 2023. It's intended to be an intermediate version between GPT-4 and what is widely anticipated GPT-5. GPT-5 is already in development, and the advances in technology have been so rapid and so broad that actually it's been reported, I'm sure you've seen, that there are concerns over what the technology may be used for. And so as a result, over 1,000 leaders, technology leaders, have sort of circulated and signed a petition to sort of pause the development and to either halt development beyond GPT-4 or, in other words, not go to GPT-5 anytime soon. So, so then the question arises, sort of how does this type of GPT work to benefit the healthcare sector, and particularly with respect to the administrative activities that consume so much of not just the sort of administrative staff, but the practitioners, the providers, the clinicians themselves. And we look particularly at the administrative costs, which are apparently between 15 to 25% of our total national healthcare expenditures. The benefits of using artificial intelligence for some of these tasks are fairly obvious, both in terms of time saved and particularly time that can be spent on direct patient care instead. So among the benefits that are touted for using AI or GPT to reduce these administrative burdens are the increased productivity of everyone involved in the provision of healthcare, greater efficiency in the administrative work that's actually being performed, and reduced costs, which presumably work to all of our benefits. But with these benefits come risks. And specifically, when we sort of drill down and look at what it means when GPT is used to produce these prior authorizations, progress reports, certificates of medical necessity, and referrals, that's where we need to be very careful about what exactly the app is doing. These types of documents are used to support claims for payments, particularly progress notes and procedure notes. And that means that they are scrutinized. When an audit comes in, that's what they look at. When the federal government comes in and looks at claims, that's what they look at. So anytime you're talking about or dealing with information that is used to justify the provision of services and to support billing claims, it carries a risk of fraud and scrutiny. Healthcare, as I'm sure I don't have to tell you, is the leading source of False Claims Act cases in the government today. There are literally hundreds of cases filed every year and billions of dollars in recoveries. And for at least the last 10 years, when the Justice Department announces False Claims Act recoveries, the overwhelming majority of those recoveries are made within the healthcare sector. And clearly, the GPT world is aware of this. The Doximity website, the DocsGPT itself, carries these significant warnings on the website. Since the letter content is AI generated, please make sure to review and ensure accuracy before you submit. And every response that is generated to a medical prompt reminds the users in all caps to please edit for accuracy before sending. So let's sort of talk a little bit about how these limitations affect healthcare providers. The GPT, as I indicated, is based on the information that is available, created, and published online. And it will respond with accurate details based on the information that is accessible online. But where there are gaps, the GPT may incorporate its own data, and these are called hallucinations. GPT 3.5, which is what's being used for DocsGPT at the moment, has very limited knowledge after 2021. On the other hand, in the announcements involving GPT-4, commentators noted that it is 40% more accurate than GPT 3.5. So again, we see that sort of improvements are directed towards speeding up the availability, accessibility, and usability of these apps. On the other hand, a record that is generated by artificial intelligence that's false or inaccurate or a hallucination may result in a false and therefore possibly fraudulent claim. That creates a risk of denial or recoupment, as well as, in the bigger sense, possible False Claims Act liability. We still have humans involved in this process, and if to err is human, then GPT is as much subject to those errors as any other indicator. The risk of sort of carelessness may actually be greater when you're relying on GPT to generate the records. Similar prompts, examples like patients that are the same age or similar conditions, will presumably generate similar or even identical language responses. And as this sort of continues to develop or be in greater use, reviewers or auditors may be skeptical when they receive claims that include the same language or appear to involve the same circumstances. And that may actually mean, at least in the short run, that these claims will be viewed with less deference and greater scrutiny. There's also clearly a greater risk that protected health information will be entered into the system, which in itself raises potential HIPAA and privacy concerns. So at a recent conference, a compliance officer was asked for their thoughts on ChatGPT and responded, not heartburn, but actually an ulcer. Obviously, this is a concern. How it's used, how dependent, how reliant the users are on the technology for the bulk of the work is obviously going to create concerns. Interestingly, also, just within the last few weeks, the Second Circuit Court of, more than a few weeks, the Second Circuit Court of Appeals came out with what I believe is the first court decision that discussed difficulties with flawed AI in healthcare in a False Claims Act case. EviCore provides prior authorization and utilization management services for the insurance companies that participate in Medicare Advantage and managed Medicaid programs. They were sued under the False Claims Act with allegations that the requests were being approved based on flawed criteria and without human manual review, which then, it was alleged, caused the insurers to bill the federal healthcare programs for medically unnecessary services. And the argument was that because the AI was flawed, the services company was providing worthless services, which in the False Claims Act context means services that were the equivalent of no performance at all, and therefore a basis for claims of fraud. The district court actually dismissed the case, saying that it didn't meet the test for worthless services and that it hadn't been pled properly. The Court of Appeals agreed with the court's ruling that it had not been pled properly, but very explicitly carved out its refusal to address the worthless services argument, which means that a theory that flawed AI can constitute a worthless service or a basis for a claim under the False Claims Act is wide open. And I'm confident that we can expect to see more cases in the future on this point. Finally, if it isn't clear, it's still clear that the GPT is only as good as what goes into it, at least so far and for the foreseeable future. And so to that extent, users should be not only cautious about how they use it, but should also perform the types of manual checks that verify that the information that is being generated is both accurate, relevant, and fulfills the purpose for which it was asked by the user. I think we're going to be seeing some changes very rapidly in the near future. I wouldn't be surprised if within the week we see more announcements about new uses and developments for the apps, and specifically see them applied in various healthcare sectors. So thank you very much for having me here.
Sara, that was wonderful. And my goodness, 27 minutes to pace yourself through all that wonderful material was awesome.
I'm sorry, it was
No,
no
it was
longer than I
perfect.
thought.
No. I was hoping 30 minutes, so you were perfect.
Oh, okay.
I always take notes, so I like about 7 questions I can ask But I also encourage the audience to be able, their questions take preference over mine. So I encourage you all to raise your hand. I'll be looking at the participant list, hoping to see your pop up, and we'll be able to get you some voice time. And Janice, I know you're not shy, and I want to give you the stage to ask your question.
All right, yeah. So I was just wondering, sorry, let me just actually go back. Sorry, this is Janice Karen from the Massachusetts Health Data Consortium. I've done a bunch of experimenting with ChatGPT recently, and we have not been impressed at all with the results we got. And we did, I should tell you that we did not experiment on actual health data. We experimented on health data and interoperability related marketing things. So a lower key and requirement that it be accurate, but we did not get very accurate responses or very good answers to most of the things that we asked it. And so when you talk about putting this into production for creating medical notes, that scares me quite a bit. Can you, do you have any sense of, whether that's something that people are talking about doing soon, or what additional training work or what they're going to do to ensure that the results are going to be significantly better than the types of results that are happening now?
So I mentioned that DocsGPT is being tested as a beta version. So basically it's, I guess, at least as a layperson, I would characterize it as something that's in development and being fine-tuned based on sort of how users are using it and what they're learning from using it. I think the real answer to your question, however, lies in the extent to which and how rapidly the GPT numbers go up from 4.5 to 5 and presumably beyond. And at some point, we're expected to reach a point that's called artificial general intelligence, at which point it will be as if we're, again, as I understand it, as if we're communicating human to human. And at that point, I think all bets are off. But one thing that I did see as a consequence of the release of GPT-4, a year ago, it was estimated that we would reach that point with artificial general intelligence in 2057. After GPT-4 was released, it was estimated that we would be reaching that point in 2032. So, which is kind of mind-boggling. And, I don't know what that means for the future. I don't think any of us do, but it's going to be very interesting.
All right, thank you.
Yeah, thanks, Jamie.
I can come back around later if you'd like. Go ahead.
Oh, sure. Just raise your hand, Janice. We'll get you in there. It's interesting, Sarah. There was a big to-do with the Italian government, right, about them using their data to train the model. And it kind of raised the thoughts of what kind of data are they using to train their models? And, of course, there's the PHI concern. We hope that if they are going to get into medical policy, they're using de-identified data. Any insights on how they're training it from a healthcare perspective?
If you're talking about sort of the DocsGPT itself, all I can say, since I'm not a member, I don't have access to the actual use of the website, but I know that there are any number of comments about the HIPAA protections that the website already has in place, because Doximity does provide a service in which claims can be transmitted to the insurers. And so that predated the development of the DocsGPT app.
Okay, thank you. And I assume, I believe I read there's a nice API for other apps to utilize that as a source of information, correct?
Yes.
Yeah. And so I would assume that's what Epic and Microsoft are doing to interface with their application. And just wondering, is there much like technologies, when there's a really cool application, say weather, everybody now is going to be using their APIs to feed their weather apps. Are you seeing like a buildup on different companies trying to use that as a processing source?
I think this is sort of more impression than sort of actual knowledge or evidentiary-based assumptions. I think that things are happening so fast that most companies, just like most individuals, are just trying to play catch up and figure out how it works.
Okay.
And I think there's a lot of experimentation that might look aimless, but that is going to have consequences down the road. One of the users for GPT-4 actually invented a new language.
No. Yep. And do you have any inkling how they plan on making money at OpenAI?
No, I don't.
Okay.
I wish I did.
Yeah, well, without this buzz, you think they'd be valued huge, right? Billions.
Right.
Right. Janice.
Hi, so my next question, ONC just put out a new proposed rule that has some components that around AI usage and transparency. Do you have any sense of how well some of the current ChatGPT or DocsGPT components would fit in with some of the requirements to perform, document, and publish information around intervention risk management, around the validity, reliability, privacy, and security of the AI models, around data governance and the evaluation of the ground truth data, and the representativeness of the data. There's a whole bunch of components. I haven't actually fully absorbed the rule yet, but there's a whole bunch of requirements around AI for any AI that's actually used in conjunction with certified health technology. So do you have any sense of how that might fit in with what's currently being done in this world?
I'm afraid you have taken me out of my depth at this point. Ed, you promised that there were some technological experts here who might be
Sorry.
better. No, it's in fact, I'm making a note here because I want to follow up on your question for myself.
Yeah. So let's call out to the audience. If anyone would like to raise your hand to help Janice, that'd be awesome. And if not, Janice, come back next month. We plan on having some folks that are from healthcare, machine learning, and very into ChatGPT from more healthcare specific technology angle. So anybody like to raise your hand to answer? Okay, so stay tuned next month, Janice. All right.
Yep, I'll hold everything else to next month when we have the healthcare experts in.
All right, cool. Thank you. Hey, Sarah, you had a little up at the beginning, you had prior authorization. I assume that's something that's helping the provider form the prior authorization request letter. Is that correct? Or is there a different angle to that?
Yes, that's what it is.
Okay, yeah, there's so many people on us because they're looking into API enablement of prior auth. So I want to make sure that was clear to everybody. So thank you for there. I'm curious, when it does come back with an error, something that you don't like that response, what's the mechanism to actually provide feedback to train it?
Basically, to keep asking and refining your question.
Okay, so if you don't like,
which I know sounds very simplistic, but that literally is how it's being done.
Okay, and I'm just thinking of something very nefarious. I'm a terrible government organization wanting to impact US healthcare in a very bad way. And if I were able to somehow use the API to train it to say the wrong things, is there any sort of guardrails to prevent something like that?
Well, if I was using the information that way, presumably I would be directing the technology to produce the I guess I'm not quite sure of your question.
Oh.
I can say that the apps have been and are continuing to be developed to eliminate bias and discriminatory biases from them. Now, how they do that, I couldn't tell you,
Okay.
but I know that among other improvements between 3.5 and 4.0 was an improved bias removal. In fact, they estimated that it was actually 80% better.
Wow. Okay, it'd be interesting to learn next month about that. Thank you. Okay, questions. Don't be shy. Any questions that you may have, or please raise your hand. Give you a few minutes to think it through to ask Sarah. But Sarah, thank you for coming and helping us today and addressing this buzz. You know, a lot of us attended today to to learn more about it and what it is and what it can't do, and it certainly has a lot of potential, but also it can be a wee little scary. So, okay. Well, Sarah, any final thoughts?
No, just the last one. It's only as good as what goes into it so far. And we're going to be seeing, I think, quite a lot going into it in the next couple of years.
Okay, all right. Well, Sarah, thank you so much for presenting. We were honored with your presence, and your presentation was awesome.
Thank you very much.
Okay, thank you everybody for attending. We'll see you next month.